Welcome back. We have been studying legal implications in nursing, and today we're going to go even deeper, and we're going to be looking at some words. We're going to have a little mini lesson in what it's like to go to law school today. And I didn't go to law school. My beautiful brainy sister did, and she is a great lawyer. However, I always like to say something that we have to do in nursing is to kind of be, at least I say this about myself, jack of all trades, master of none. What I mean by that is we kind of have to know a little bit about everything, okay? And so being a licensed professional nurse requires us to know a little bit about the law. And so it is in our best interest, right, to safeguard not only our patients, but ourselves, to be aware. Because it's so easy to be accused of doing something wrong in the clinical setting and feeling like you are a failure, okay? And it's scary, and I get it. And so that is one of the reasons why I think it's important for us to educate ourselves on what these words mean and how we can better understand when things go wrong, what went wrong, and what is our actual, reasonable amount of blame, okay, that we should be taking upon ourselves for the actions that we are performing, okay? And this is difficult. I mean, this is the reason we have lawyers and courtrooms, and laws and statutes and policies and nurse practice acts, so that we can have rules in place so that when things do go wrong, we can identify what went wrong, how it went wrong, and, who's to blame, all right? So we're going to start out by talking about what a tort is. And a tort is litigation in which one person asserts that a physical, emotional, or financial injury was the consequence of another person's actions, okay? Or failure to act, all right? So the person got injured because of something that you did, or because you did not do what you were supposed to do. And they suffered some kind of physical or emotional or financial loss as a result. That is the definition of a tort, okay? And torts can be intentional, all right? In the case of assault and battery and false imprisonment. We're going to talk about what these are. So intentional means that you did it knowingly, purposefully. So this assault is if a nurse threatens a patient with a shot or a restraint if they don't do something that the nurse wants them to do, okay? So normally we think of assault as hurting someone, but actually threat of injuring someone is actually considered an assault, right? So it's really important for you to know that assaulting a patient is threatening them, okay? Battery is when you intentionally touch a patient without consent, all right? So when we go into a patient's room and we wash our hands and we introduce ourselves and we're explaining what we're going to be doing, we are making eye contact with the individual if they're awake, alert, and oriented, and then we are going to assess them. We are getting consent. And what I mean by that is we don't have to have every single patient sign a form before we can put our stethoscope on them, right? When I walk into the room and greet the patient and explain who I am and what I'm there to do, and then I walk over to them and say, I'm going to assess you now, they are looking at me, smiling, and they are giving me consent to then put my stethoscope on them. Okay, I'm going to assess you. I'm going to check your pulses. And then we move in and we physically touch the patient, right? There is this kind of exchange that goes back and forth between the nurse and the patient where we have consent, okay? If we touch the patient without consent, so in other words, if the patient says, get away from me, don't touch me, then we better be getting away from them, and we better not be touching them, okay? So there's an important distinction there, all right? And we're going to talk later about times when we do have to, deal with a patient who is confused, on drugs, in the ER. What do they do when the patient is not in the right state of mind, right? That's a whole different conversation, okay? What we're talking right now about is what the definition of battery is, and that is intentionally touching a patient without their consent. Don't touch me, get away from me. So the Federal Nursing Home Reform Act of 1987 is very important to know about, because what it said is that residents in nursing homes have a right to be free of unnecessary and inappropriate restraints, okay? This includes psychoactive drugs administered for the convenience of the staff, meaning that these are not required to treat medical symptoms. And I see I misspelled a word there, but the word convenience means that person's calling out all night. I'm going to make sure that I give them, their a medication that's just going to just knock them out so I don't have to deal with that patient. That is not okay, all right? That is not okay. That is considered giving a psychoactive drug for your convenience, okay? It is not required to treat insomnia. That is a medical symptom, okay? So, false imprisonment is another one of these more of an intention, right? So interference with a person's freedom to move about at will without legal authority, all right? This is a reason that a patient can leave without being medically discharged. We call it leaving AMA, against medical advice, because we can't imprison them, all right? We can't force them to stay in the hospital if they are awake, alert, oriented, have full consciousness, and are appropriate and telling us they are getting up and they are walking out. We cannot stop them, okay? However, it's important for us to do the right documentation to show that they left against medical advice, all right? Because maybe they are critically ill and leaving the hospital will result in their death, okay? And so they can still go, but we need to say, we told them not to go, right? They're leaving against our advice for their safety, okay? So restraints are devices or chemicals that restrict movement. And they are actually used with the intention to subdue activity, all right? So if we have a patient who's in the hospital, they're confused, and they're pulling out their IV, and they're pulling at their tubes, and they're going to disrupt something very important for the provision of safe care, then sometimes we have to order restraints, okay? And we do that because they need the IV to get their IV antibiotics, so we can't having them pull it out, because if they don't get their antibiotics, then they might get an infection. Or if they pull out this tube, there's a consequence that's a medically, harmful consequence, okay? So I want you to remember that drugs can be considered a restraint. We have examples here of a vest restraint. This person is sitting up in a wheelchair. He is still being restrained because that vest is keeping him stuck in that wheelchair, okay? We see a woman in the corner over here with another type of restraint that is a tray that is attached to her wheelchair, restricting her from getting out of that wheelchair. Again, it's considered a restraint. I mentioned in a previous lecture that putting all 4 of the bed rails up is considered a restraint, okay? So these are all examples of restraints. There are vest restraints, there are wrist restraints, there are all different types of restraints. Now, how do we know, what is considered appropriate use of restraints? Okay? We use restraints to ensure physical safety, not only of our patient, but others as well. Okay? So in the case of safety of the patient or safety of others, we may need to use a restraint. Restraints require written order of the provider to be renewed every 24 hours. So what that means is if you have a patient in any setting that is in restraints, that means that the doctor has to come in and reassess them and rewrite an order to the restraints have to be maintained every 24 hours. So the doctor comes in and assesses the patient and says, yes, I'm writing the order for another 24 hours. Or the doctor comes in and checks on the patient and says, no, I do not believe that this patient should still be on restraints. Then the restraints must be removed. Okay? So we've got to be checking every 24 hours to see if they need the restraint. Okay? We have to show that alternative attempts to keep the person calm or safe have been attempted. So that would be like using a bed alarm. So we've tried to have the patient on a bed alarm. We've tried all these other things to help keep the patient safe, but they have been unsuccessful. And we know that the patient is still at risk for harm. Okay? So we can't just automatically put the patient in a restraint. We have to show that we've tried other measures to keep the patient safe. We need to get the consent of the individual or their family members, and we really need to think of restraints as being a last resort. Okay? A last resort. So, there are other types of torts. So we just finished talking about all the torts that are considered kind of intentional. Okay? These torts are considered quasi-intentional. Slander, which is verbal defamation, which means you go around saying something really horrible about another individual. Okay? That's called slander. Libel is written defamation, where it occurs somewhere in writing, like something gets published in a newspaper or published on the internet or somewhere where you're defaming an individual with written things that you're saying about them. So slander is verbal defamation, libel is written defamation, and invasion of privacy, where you're publicly disclosing information about somebody that should not be publicly disclosed. All right. So in the case of malice, you are maliciously acting. You're committing a tort of slander by labeling a non-drinker an alcoholic in front of his or her employees. Okay? This is a quasi-intentional malice against a person. You're labeling somebody who doesn't drink as an alcoholic in front of his or her employees to try and make them out to be someone who is not to be trusted and not to be respected. Okay? So we have, the same thing happen in our clinical practice. And so medical malpractice versus medical negligence is kind of something to consider. And what's the difference and who decides? Well, fortunately, it's not us. It's not me and it's not you. It's the courts, it's the lawyers, it's a jury. And so those are things that get taken out of our hands and into the hands of those who are able to argue these things. But malpractice is considered professional negligence, which differs from kind of simple negligence. Why is that? It's because we have a license, all right? So it holds professionals to a higher standard of accountability, okay? And then that question comes in. Did the provider of care act in a manner comparable to other providers with the same level of experience and knowledge. Okay? So then there's something called gross negligence. And in gross negligence, what we have is unreasonable action. A nurse acts with no concern for the rights, safety, or welfare of the patient. No concern. In other words, you're willfully disregarding a known safety issue, and you're putting the patient in harm's way, and you're doing it in a very obvious and grossly negligent way. Okay? Put another way, no reasonable person would have done that. You knowingly fail to carry out an act, and it causes harm to the patient, or you intentionally carry out an act that causes harm to the patient. Okay? So, elements to consider are duty. We talked about that. Obligation. We have an obligation to provide safe care. There was a breach of that duty. We failed to provide that safe care. There was causation, meaning that the nurse's action or failure to act actually caused harm, and then injury. And we've talked about that. Physical, psychological, or financial harm occurred. So, failing to check an ID band and giving the wrong drug to a patient that causes harm, right? We always want to remember to check 2 patient identifiers and check their ID band for name and date of birth before we do a procedure, before we give a medication. Giving medication to a patient that they're allergic to it, and the drug allergy is clearly stated in the medical record or clearly stated on their ID band, right? And that goes for other things too, right? If someone has been clearly identified to be a high fall risk, to have drug allergies, to be a DNR, and we're going to talk about that a little bit later, then what we're saying here is that we need to be using our nursing practice by remembering to do the things that we are trained to do. And that means that we need to be checking an ID band, and we need to be making sure that we're checking the MAR and not giving a medication to a patient that they are allergic to. Okay? And so these would be just, these would be, being forgetful, being stressed, being overworked, being tired, right? We talked about this earlier. It's a form of negligence, right? It happens, okay? It happens. Whether or not something is going to be considered prosecution, right, for legally prosecute in a court of law for this, it's these questions that are going to be asked, right? Very few nurses are actually prosecuted in a criminal manner, but it does happen, and it can happen. And so we want to make sure that we're following every standard of nursing care that we can. But we do know that we're human, and we do know that mistakes happen. Another example here might be performing a procedure on a patient without assigned informed consent. And we're going to talk about informed consent next time. But what this means basically is that, we have to make sure that our patients fully understand what it is that we are going to do to them before we do it. And so we have them actually sign a paper that says, I understand not only what you're going to do, but I understand that there are risks to what you're going to do, and I understand that there are maybe alternatives to what you're going to do, but I am choosing to do this anyway. I'm choosing to get this surgery done, even though there may be alternatives to the surgery, even though there are risks to the surgery, and I'm signing to get the surgery anyway. And that's after a nurse or a physician has gone through the informed consent with you. So we're going to kind of go into more detail about what informed consent is next time. I hope that this was helpful for you to get kind of an understanding about what malpractice is, what gross negligence is, what negligence is, because it's different, right? Being intentional about what we're doing. None of us ever mean to cause harm, okay? So I want you to study some of these things. Your textbook is excellent for being able to explain some of these things in more detail. But until next time, have a great day.